So I've always wanted to say this in the context of the Oscars, but I'd like to thank the Academy. So previous speakers have referenced Yuri Bronfenbrenner's social ecological model. And the talks yesterday focused on the individual level, the microsystem, or the context directly influencing youth, so family and peers. The mesosystem, or the interactions between those microsystems, which are an indirect influence on youth. And my talk will focus on the exosystem, or the community, environments, networks, and formal systems. And so an example of this is being mindful of how there's a feedback loop between exposure to community trauma and then youth perpetration of violence. And then I'll also move out and focus a little bit on the macro system. So the importance of taking into consideration historical context, history of oppression and discrimination, as well as the intergenerational transmission of violence and trauma. I also want to highlight that this is a nested model, so there should be bidirectional arrows going through each of these systems. And so while it is labor-intensive and difficult to do a holistic intervention that tackles all of these systems, we do want to keep in mind that some of these community-based programs will, of course, invoke the help of parents or address peers as a key leveraging interventionist. So as Angela noted, I will be talking about the current research on the effectiveness of community-based bullying prevention in related fields, underscoring social and cultural norms. I'll highlight the challenges to community-based participatory research, as well as do a little bit of translating knowledge into policy or practice. So to begin with, bullying does occur outside of schools. It occurs on the way to and from school and in the community. And with regard to youth violence, research from Snyder and Sickman in 2006 found that youth are 90% more likely to be violently victimized in the hours from 3 to 5 p.m. on school days as compared to after 8 p.m. Yet most community-based programs are not evidence-based programs. And what works is not effectively communicated to practitioners. At a more basic level, there's limited research on which community-level factors most affect bullying outcomes. A caveat to this is some of Candace Odger's and colleagues' work from 2006, which highlights the importance of the protective factor of neighborhood or community-level collective efficacy. And this is defined as a neighborhood's connectiveness and their willingness to intervene with regard to youth problem behaviors. So you can think of this like when we talked about the bystander effect, but now it's taking a village. It's at the whole community level. And some real-world applications of this are found in Baltimore. Deb Verholden mentions an informal program called Safe Passages, where garbage collectors would act as informal monitors, watching kids go from their home to the corner market to buy breakfast to their school. Another example of this comes out of California, where a pastor developed a program for severely at-risk youth that were caught in the cycle of recidivism and the revolving door. And it's a program called Homeboy Industries, and it's for men and women of color primarily who are disproportionately incarcerated. And the idea is their slogan is jobs, not jails. So it's an idea of here taking young adults and providing them with skills and training so that they can break that cycle. So I'm going to refer to the Blueprints for Healthy Development criteria for program evaluation. I want to commend the Blueprints for providing this database. There's also OJJDP, there's also SAMHSA, and several others. The nice thing about Blueprints is they do synthesize across the other registries for programs. So when you go to their site, you can see how the other programs matched up based on those registries. And their criteria fall into promising programs, so that's meeting a minimum standard of effectiveness based on intervention specificity, evaluation quality, intervention impact, and dissemination readiness. So that's just the need for one study that meets these criteria to make it promising. A model program, on the other hand, meets a higher standard and provides greater confidence in the program's impact on outcomes. And this is based on a minimum of 2 high-quality randomized control trials or 1 high-quality RCT and 1 high-quality quasi-experimental evaluation. And also, the positive intervention that the impact sustained must go on for a minimum of 1 year after the program intervention ends. And I want to take a moment here to pause and say, as the family folks did yesterday, there really are no programs in the community that have been developed and are out in the field to a greater extent that would even be in this implementation and evaluation phase that expressly focus on bullying prevention and early intervention. So I'm going to talk about our programs that are in this blueprint registry and where we can get kind of kernels and ideas from them, apply them to bullying prevention. So I'm going to highlight the Big Brothers and Big Sisters of America program. And the seminal RCT, the most rigorous RCT on this project, actually it should say 1991 is when that came out. It's an indicated program. So it's for really disadvantaged youth that are coming from single-family homes. They may be coping with the stress of an incarcerated parent. And they're also exposed to violence in their home and in the community. I'll also highlight the Communities That Care system, which isn't necessarily a specific program, but a framework for where communities can implement evidence-based practices. And that program is universal and promising. And then I'll briefly touch on multidimensional treatment foster care, MTFC, which has a preponderance of evidence. It's really for indicated high-risk youth, and it's proven model to effective. So to talk a little bit about Big Brothers, Big Sisters, it's the largest and longest running mentoring program in the US, and it's really based loosely on the social bonds theory, the idea of leveraging this important adult role model in a youth's life. It's also drawing on some of these issues of found community and built family. So by providing this match, and it's based on commonalities such as region, shared activities, and common values, the youth is now able to form relationships, and even if it's in a social setting, going for ice cream, or in a tutoring setting, learn how to engage positively with adults, and that may translate to peers. And some of the key outcomes from the largest RCT for Big Brothers, Big Sisters are that youth that were in the match group, and I want to highlight that there is also the level of dosage. So mentors must commit to at least 1 year, and there's a frequency issue. They have to see the youth between 3 to 5 hours per week. So that's definitely at play in terms of, in addition to mentor efficacy, how well they're able to build that relationship, and of course the mentor-mentee alliance. And I also want to just go back and highlight that that is a challenge, is finding people to show up and be available in that capacity. But when that does occur and they are able to make those matches, youth that are in the Big Brothers, Big Sisters program, it cuts their illicit drug initiation by 46%. It reduces their alcohol initiation by 27%, although that's only marginally significant. And youth reported that they were less likely to hit someone at the 1-year follow-up. And there were significant reductions in truancy and cutting class, and significant risk and protective factor effects. So this is important to note, improvements in the quality of their relationship with the parents, and marginally significant improvements for peer emotional support, as well as some school effects. In terms of that Communities That Care framework, there is a 5-step model that allows communities to implement evidence-based practices. So the first step is getting started, conducting focus groups and needs assessments to identify what are the most pressing issues for that particular community. And then the next step is getting organized, so bringing key stakeholders to the table and finding out more about their capacity. And then step 3 is really where the research gets injected. So that's developing a community profile, again, based on that blueprints registry, to identify model or promising programs that best fit with the community's needs. Step 4 is creating an actionable plan, and step 5 is implementing and evaluating it. And then this slide just highlights some of the key core characteristics that cut across some of the programs. So key CTC outcomes, there were reductions in self-reported violent behaviors at the 1-year follow-up. And compared to youths in the comparison group, CTC youth were 25% less likely to have initiated delinquent behavior, and 32% and 33% less likely to have initiated alcohol and cigarette use, respectively. Briefly, MTFC, like I said, is really for high-risk youth. It's an out-of-home placement, so it is a bit intense. And the youth usually come to MTFC from the referrals from the juvenile justice system, foster care, and mental health systems. And across the board, what we see here is that for both boys and girls, there are reductions in recidivism, violent offending, and fewer days spent in locked settings. I'd like to spend the remainder of my time talking about community-based participatory research factors. And so that's really, this type of research is really bringing community members to the table, shoulder to shoulder with interventionists and researchers. And some of these factors cut across school-based interventions as well, but there of course is the issue of buy-in. So relationship building, engaging gatekeepers, trust, ongoing communication, and return on investment. And a great example of trust building and ongoing communication comes from Leff and colleagues' work, where he talks about meeting with community members in the community instead of at an academic setting where there might be a perception of a power imbalance. Having informal meetings over a meal so they can talk about what both parties' perceptions are for their goals to be achieved and to reach an agreement that they will both remain at the table even when conflict or disagreements arise. There are also the issues of capacity and sustainability. And in terms of capacity, something that Big Brothers and Big Sisters cite as an issue, even though they've been the longest running program, is that finding an adult mentor that's willing to commit to the youth for as long as required. Contrary to that, the Holistic Life Foundation, which is a nonprofit based in Baltimore that provides mindfulness-based interventions in an after-school setting, really capitalizes on young adults in the community, trains them to become the interventionists who then administer the mindfulness in the after-school setting. And what's great about that is they're building their capacity and their staff, but they're doing it from a community perspective. And the kids that are then receiving the intervention are seeing someone that looks like them that they may already know from their community. And so then it's sustainable and it's done. We talk about changing school climate. This is changing the cultural or the community climate. And it's also invoking that construct of neighborhood collective efficacy. In terms of cultural responsivity, there are a couple issues I want to address here before getting into the Partners program. One is the idea of the level of cultural adaptation that may be needed. So there's superficial adaptations, which could just be a translation of a measure into Spanish or a program website into another language. But there's also deep adaptations. And I would say that some of Stephen Leff's work with the Partners program is definitely community-based participatory research, but is also sensitive, not only sensitive, but responsive to those issues. And this is some of the challenges to when you take that approach. So meeting standards of effectiveness. We have those blueprint guidelines for what counts when we're trying to evaluate a program as promising or effective. But the idea here is how do you balance the demands for systematic implementation of a community-based intervention while still being responsive to the immediate needs of the community? There's also the issue of generalizability across contexts and communities. So if you take a program off the shelf that was developed in another country or in an area with suburban youth, it might not apply to urban at-risk youth. But then if you adapt it for that community, it might not apply to rural youth. There's also the issue of community-defined success. So some of the measures that we use might not be applicable for certain communities. So in these sites here, Leff and his colleagues actually met with community stakeholders and either worked to adapt existing measures or to develop new measures that more accurately represented the community's experience. And this was a rigorous qualitative process, really showing that researchers can work with the community to develop new measures that still meet scientific standards, but that are culturally responsive. And lastly, with my remaining time, I want to talk a little bit about my work in California that may relate to translating knowledge into policy or practice. So I've had the opportunity to work on a project that's funded by Proposition 63, which is the California Mental Health Services Act. And what that is a statewide evaluation of mental health services. And a key accomplishment that's come out of this really came out of the California Department of Education's Student Mental Health Policy Work Group, which was loosely in existence before this funding came through, but then became more formalized once the funding was in place. And their accomplishment was a teacher credentialing initiative, which now requires teachers to sit for and understand student mental health. And it's not that the teachers become student mental health providers, but that they are aware of the signs and then can appropriately refer students to the necessary stakeholders. And a key issue of what made this work was that the committee was cohesive. As I said, they were already in place. They also saw this as a key opportunity. So even though they had other priorities on the table, they were able to push this forward because they knew that this teacher credentialing committee only met every 10 years. So how does this apply to our field? Well, this may be controversial, but there is this idea of voluntary accreditation processes for community-based organizations. And even floating this idea might start a conversation about the great importance of community-based research that's also evidence-based research. And lastly, I would just like to commend movements like Strive, which strives to reduce youth violence everywhere, and other types of practices that can really start from the community. So grassroots movements such as the mindfulness movement, positive youth development, or random acts of kindness, which I'm happy to speak a little bit more about later. Thank you.